Hello everyone, our curriculum's name is the Juntos Diabetes Program, and our group members are Vivian Nguyen, Bianca Silva, Natalie Rivera, and Diana Espinoza. Our overall topic is diabetes, and as a group, we believe that diabetes education is a necessary tool for prevention and advocacy among disadvantaged groups. Today, our population is older adults among the Hispanic and Latin community. The Juntos Diabetes curriculum is targeted towards the older Hispanic Latino population residing in the Los Angeles County area. This is because this population faces several disadvantages and are at an increased risk in developing diabetes due to lack of resources when it comes to healthcare, preventative care, and knowledge of proper management. According to the CDC, the Hispanic and Latino population has genes that increase their chances of developing diabetes, have higher rates of obesity, and come across additional barriers that make managing diabetes harder. There are many factors that contribute to diabetes among older Hispanic Latino adults, but it is also important to note that the health disparities faced by this population has created a stronger need for the prevention and delay of early onset of diabetes. To further add, because Hispanics are at an increased risk of developing diabetes, there is also an increased risk for stroke and death from stroke. The prevalence of having hypertension and diabetes among this community is increasingly high, which contributes to complications. There is also an increased risk of amputations for those in this community who don't have the appropriate care or resources to manage diabetes to prevent from foot ulcers from getting so severe that they need to be amputated. And over time, diabetes can affect different parts of the body. The leading cause of death among people with diabetes is actually heart disease. Over time, high blood sugar damages blood vessels and nerves that control the heart. Individuals with diabetes are 2 times more likely to develop heart disease or a stroke as opposed to someone without diabetes. As a group, we created the Juntos Diabetes curriculum, which is significant to the older Hispanic and Latino population, because through the curriculum, we aim to increase the comprehension of diabetes by highlighting specific units that will assist in giving the targeted population the proper knowledge for the importance of healthy eating, staying active, and self-monitoring their diabetes in order to live a healthy life.
Due to the prevalence of diabetes among this population, we decided to create the Juntos Diabetes Program. This is a curriculum that aims to reduce the prevalence of diabetes among older Hispanic and Latino adults by increasing the knowledge in ways that they can prevent or delay the onset of diabetes. Along with aims to increase the knowledge among this population, this curriculum also aims to help reduce the stigma surrounding diabetes, because this is a condition that is not solely caused by weight gain or poor diet. The curriculum will aim to address other factors that are associated with and can lead to an increased risk of diabetes. Furthermore, the implementation of this curriculum can provide more education and development of resources needed to address population-based health disparities. The curriculum is comprised of 4 specific units. These units are all aimed to address the main goal of this curriculum. The first unit is called Recognizing and Defining Diabetes. The unit objective for recognizing and defining diabetes is, upon completion of the unit, the learner will be able to comprehend the importance of diabetes and how to recognize symptoms of diabetes among the older Hispanic Latin community of Los Angeles County. The second unit of this curriculum is called Healthy Eating. This unit objective says that upon completion of this unit, the learner will be able to recognize the importance of implementing healthy eating habits to reduce the risk of diabetes among the older Hispanic or Latino population in Los Angeles County. The third objective is called increasing physical activity. And upon completion of this unit, the learner will be able to interpret the importance of keeping up with regular physical activity among the older Hispanic Latino community of Los Angeles. And finally, the fourth unit, which is called self-monitoring and taking medication. This unit objective states that upon completion of the unit, the learner will be able to recognize the importance of having adequate knowledge for effectively monitoring and managing one's health within the older Hispanic Latin community of Los Angeles County.
The sample learning opportunity that we will be discussing today is Unit 1, which is recognizing and defining diabetes. The unit objective is, upon completion, the learner will be able to comprehend the importance of knowing what diabetes is and how to recognize the symptoms of or the onset of diabetes in themselves as well as others in the older Latino community in Los Angeles County. The enabling objective is, upon the completion of the lesson, the learner will be able to differentiate 3 differences in type 1 and type 2 diabetes. And for the evaluation technique, we will be using selected response and questionnaire survey. The lesson will include a 10-minute introduction, a 7-minute pre-test on Kahoot, a 15-minute PowerPoint presentation on the unit of recognizing and defining diabetes, a 7-minute post-test on Kahoot, and a 5-minute review and conclusion of the lesson. The lesson will begin with an introduction of the topics that will be covered in the class today, and then after, the Kahoot pretest will begin, where there will be questions on diabetes, the different types, and other topics that will be discussed within the PowerPoint as well. The PowerPoint will go over the definition of diabetes in general, as well as the specifics of type 1 and type 2 diabetes. We will also go over the main differences between type 1 and type 2 diabetes. After the presentation, there will be a Kahoot post-test to evaluate if the audience has learned through the presentation. And at the very end of the lesson, there will be a concluding question. The materials needed for this lesson will be a laptop, a cell phone or another type of electronic device, connector cables, the lesson PowerPoint, a projector, access to internet connection, and the Kahoot.
This curriculum emphasizes the importance of diabetes education among older Latino and Hispanic populations who reside in the Los Angeles area. The curriculum is presented in a clear way, meaning that it is straightforward and is tailored to the target population. It is done in a way that allows the target population to understand and gain knowledge while being provided the materials to help improve their quality of life. The concepts included were defining diabetes, focusing on healthy eating, emphasizing the importance of physical exercise, and teaching participants how to self-monitor their diabetes. The Hispanic and Latino community is among the highest groups at risk for type 2 diabetes, and for that reason, it is important to provide resources that this community needs. As previously stated, there are many health risks that can stem from diabetes, and many get worse and may get worse if proper monitoring is not being done. Diabetes can be prevented or delayed, and the Juntos Diabetes curriculum allows the target population to engage in learning about ways that this can be done. Listed here are resources for instructors, the first one being the American Diabetes Association, which allows the instructor to have access to multiple links and give a multitude of information regarding statistics and facts about diabetes, different programs, and access the reviewed literature in order to understand the different types of diabetes. Next, we have the Centers for Disease Control and Prevention resource, which provides the instructor more information about key identifying symptoms that can help individuals differentiate between type 1 and type 2 diabetes. Living with Diabetes at the Diabetes Research Institute provides helpful tips on how to manage ongoing diabetes in regards to food, exercise, nutritional needs, and possible symptoms. It also provides specific categories for different ages and diabetes types. The American Diabetes Association offers guides that teachers can utilize as a simple way to incorporate training tools for students. It also provides modules, PowerPoints, PDFs, plans, and videos on diabetes topics ranging from the basics of diabetes to blood monitoring, which can be taught to students. The last resource is also from the CDC and gives health educators a number of tips to keep patients or people at risk for diabetes engaged in learning about type 1 and type 2 diabetes. In addition, it provides information on prediabetes and lifestyle changes for participants. Next, we have resources for students or participants. The first one is Taking Control of Your Diabetes, which provides information on how to live with diabetes and includes posts from others who have successfully used this resource. Videos of testimonies are included. The Diabetes Education Center at PIH Health is a community resource that includes resources like educational and management classes and includes events that are available to students in both English and Spanish. The American Diabetes Association has a resource that can be used by students as well because it covers many important information about diabetes and is very easy to navigate. Here, students can learn many diabetes topics ranging from basics to how to monitor through videos, posters, modules, and other simple to use resources. The National Institute of Diabetes and Digestive and Kidney Disease resource allows the students to obtain the proper information when it comes to acquiring support from safe practices and how to manage diabetes. It highlights the importance of managing diabetes and also shows students how they can be a part of diabetes campaigns, which can help develop leadership and advocate skills. The resource from Mayo Clinic can be used by learners to further understand how to manage diabetes. It provides a list of information, types of foods to consume, and which foods to avoid. It also provides information on the importance of medication. This resource allows learners to understand why blood sugar rises and lowers. That concludes our presentation. Thank you for watching.